The Coagucheck XS system from Roche measures blood clotting time for people who are taking anticoagulation medications, such as Coumadin or warfarin. It's easy to use. You just insert a test strip, apply the blood sample, and read the result. The meter automatically runs its own quality control test at the beginning of every blood test. In this program, we'll give you a quick overview to get you started using the Coagucheck XS system to perform blood tests. Then, we'll take a closer look at setting up, using, and maintaining the system for professional use. Let's look closely at the parts of the Coagucheck XS system. The Coagucheck XS Care Kit for professional use includes the meter, 4 AAA batteries, Coagucheck single-use lancets, and instructional materials. Additional parts of the system include test strips, a test strip code chip, and the test strip package insert. Now let's look at the parts of the meter itself. Here is the display, the on-off button, the M button, and the test strip guide. On the side is the code chip slot and the set button. At the back is the data port, which is an infrared window for data transfer. On the bottom of the meter, you'll see the battery compartment, the Roche Diagnostics Technical Service Center phone number, and the unit serial number. This section will provide you with a quick overview to get you started using the Coagucheck XS system to perform blood tests. Keep in mind that we are about to show you very simply how to perform a blood test, and that the remainder of this program includes more details about setting up the meter, getting a blood sample, and testing. So be sure to watch the entire program if this is the first time you are doing a test. Remember, for complete information, you can refer to the Coagucheck XS System User Manual. And always refer to the most current package insert for information on using the test strips. If you still have questions, call the Roche Diagnostics Technical Service Center at 1-800-428-4674. Make sure your meter is set up before proceeding with this quick start. To perform a blood test, you'll need the following items: the Coagucheck XS meter, a test strip, the test strip code chip, a Coagucheck single-use lancet, alcohol wipes, and cotton balls. First, have the patient wash his or her hands in warm, soapy water. Or clean the fingertip with an alcohol wipe. Make sure the fingertip is thoroughly dry. To perform a test, you'll need to have a code chip inserted into the meter. To insert the code chip, first make sure the meter is off. Then insert the code chip with the code number facing up until you feel it snap into place. To begin a test, insert the test strip to power the meter on. The meter will display the code chip number. Match the 3-number code on the display with the 3-number code on the test strip container. Confirm that the codes match. Then press the M button. An hourglass appears as the meter warms up. While you're waiting, make sure the meter shows today's date and the correct time. When the meter is warmed up, a flashing test strip appears, and the meter begins a countdown. You have 180 seconds to apply the blood drop. Gently massage the finger from the base of the knuckle and let the hand hang loosely. Perform the finger stick. Then, apply the blood drop within 15 seconds to the target area of the test strip. It's important to apply only 1 drop of blood. Don't add more. The countdown disappears, and the blood test begins. In a few seconds, as part of the testing process, the meter automatically performs a quality control test. In about a minute, the result appears on the display. Record the result according to your facility's guidelines. Remove the test strip and discard it and the lancet device according to your facility's infection control guidelines. When you are finished, power the meter off. The Coagucheck XS system is simple to set up for the first time. All you need to do is install the batteries and set the date and time. Let's take a look at how to do this. Remove the battery compartment cover on the back of the meter. Install the batteries and replace the cover. When you install the batteries, the meter automatically enters setup mode, indicated by a flashing date and the word set on the display. All settings are changed with the M button and accepted with the Set button. The date format flashes. To accept the default format of month, day, year, press the Set button. The year flashes. Press the M button to change the year. Press the Set button to accept the year and move on to the month. Press the M button to change the month. Press the Set button to accept the month and move on to the day. Press the M button to change the day. Press the Set button to accept the day and move on to the time format. The time format flashes. To accept the default 12-hour format, press the Set button and move on to the current time. The hour flashes. Press the M button to change the hour. Press the Set button to accept the hour and move on to the minutes. Press the M button to change the minutes. Press the Set button to accept the minutes. The initial setup is now complete. The meter displays a flashing strip icon. Next, power the meter off. You can repeat this process anytime to change the meter settings. To enter setup mode at other times, simply press the Set button on the side of the meter. With the meter powered off, press and hold the On/Off button to check that all the letters, numbers, and symbols on the display appear as shown in the user manual. Now power the meter off. One of the most important parts of testing is getting a drop of blood, and the Coagucheck Lancet device helps ensure that you consistently get a good drop. The Coagucheck Lancet is a single-use device designed to prevent accidental finger sticks. Using the lancet is simple. You just twist off the protective cap. Place the tip firmly against the fingertip, and then press the blue trigger button. After you use it, the lancet permanently retracts into its protective case to prevent any accidental finger sticks. Be sure to discard the lancet device according to your facility's guidelines. To get a good drop of blood, follow these steps. First, have the patient wash his or her hands in warm, soapy water. The warmth of the water helps draw blood into the fingers, which makes getting a good drop of blood easier. Or, if you prefer, you can clean the tip of the finger with an alcohol wipe. Make sure the fingertip is thoroughly dry. Gently massage the finger from the base of the knuckle, like this. Then ask the patient to let the hand hang loosely for 10 to 30 seconds to bring blood into the fingertips. When you perform the finger stick, avoid the pad of the finger because this is often a calloused area. Instead, use this area, to the side of the fingertip. Just press the lancet device against the side of the finger and press the trigger button. Now you can very gently massage the finger, starting at the base, until a drop of blood appears. Don't excessively squeeze the finger because this could interfere with the test. Now let's look at the complete blood test procedure. With the Coagucheck XS meter, you can either hold the meter in your hand or rest it on a table while you're testing. If you hold the meter, be sure to keep it in a roughly horizontal position until the test is complete. To perform a test, the correct code chip must be in the meter. The code chip automatically provides the meter with information that is specific to each lot of test strips. Each box of test strips comes with a matching code chip. Every time you open a new box of test strips, you will replace the code chip. To insert the code chip, first make sure the meter is off. Then insert the code chip, with the code number facing up until you feel it snap into place. Remove a test strip from the container and close the cap tightly. Test strips are sensitive to humidity. Also, do not touch the test strip with wet hands or wet gloves, as this may damage it. Insert the test strip into the meter with the printed side up, in the direction of the arrows, as far as it goes. The meter powers on and displays the code chip number. Match the 3-number code on the display with the 3-number code on the test strip container. Confirm that the numbers match, then press the M button. An hourglass appears as the meter warms up. While you're waiting, make sure the meter shows today's date and the correct time. When the meter is warmed up, a flashing test strip appears, and the meter begins a countdown. You have 180 seconds to apply the blood drop. Find the target area on the test strip. You can dose the target area several ways. From the top, with a blood drop from a finger stick, with a capillary tube containing blood from a finger stick, or with a syringe containing venous whole blood, or from the side with a blood drop from a finger stick. See the user manual for more information. Once you have a drop of blood, apply it within 15 seconds of sticking the fingertip. Apply the drop of blood to the target area of the test strip, either from the top or side of the test strip. It's important to hold the drop of blood to the test strip until you hear a beep. Remember to apply only 1 drop of blood. Don't add more. The countdown disappears, and the blood test begins. In a few seconds, as part of the testing process, the letters QC appear and the meter automatically performs a quality control test. A check appears indicating a successful QC test. In about a minute, the result appears on the display. Once you're finished, record the result according to your facility's guidelines. The result is also stored in memory. The Coagucheck XS meter automatically stores 300 results with the date and time in its memory. If you'd like to learn about patient management software that your facility can use, visit our website at coagucheckusa.com. Remove the test strip and discard it and the lancet device according to your facility's infection control guidelines. Once you are finished, power the meter off. If the meter displays an error message rather than a test result, refer to the Error Messages section of the user manual to learn what to do next. Cleaning the meter is simple. Use the following procedures to clean and disinfect the meter. Use only the approved cleaning solutions as listed in the user's manual. Do not spray any cleaning solution on the meter. Do not use a spray of any type. Use a damp, not wet, soft towel or cotton swab, and a lint-free tissue. To clean the exterior housing of the meter, just gently wipe the exterior. Then let it air dry for at least 10 minutes, or dry it with a lint-free tissue. To clean the interior strip guide, first power the meter off. Use your thumbnail to open the test strip guide cover by pressing its front edge upward. Clean the cover with an approved cleaning solution. Hold the meter upright with the test strip guide facing down. Carefully clean the easily accessible areas with a damp, not wet cotton swab, taking care that excess fluid does not enter the meter. Do not insert any objects into the test strip guide, as it will damage the electrical contacts behind the test strip guide. Wipe away residual moisture and fluids. Let the inside of the test strip guide air dry for at least 10 minutes before reattaching the test strip guide cover. It's that easy. In this program, you've seen how easy it is to use the Coagucheck XS system. Keep in mind that every step is described in detail in the Coagucheck XS System User Manual. We also provide a website with information on the Coagucheck XS system. So from time to time, visit coagucheckusa.com for up-to-date resources. If you still have questions after reviewing the manual, call Roche Diagnostics Technical Service Center at 1-800-428-4674. Help is available 24 hours a day, 7 days a week, 365 days a year. That's how easy it is to test with the Coagucheck XS system from Roche.